Welcome to Empower Her. Our hope is with this podcast that we will empower women to take control of their health by providing them medically accurate information that is needed when making a pregnancy decision.
Now, the topic we're covering today may be sensitive to some of our viewers. 1 in 4 women have an abortion in their past. So this topic can be triggering to some women, and if so, we encourage you to reach out to a counselor or for after-abortion support, or organizations like supportafterabortion.com, or locally, you could reach out to Muskegon Pregnancy Services.
Today, we want to explore one of the types of abortion. Today, we're going to talk about the abortion pill, also known as chemical or medical abortion. So, Darcy, what is the abortion pill and how does it work?
Well, it's a 2-medication procedure. The first medication is Mifeprex, and this blocks progesterone and interrupts the pregnancy development, prompting the detachment of the implanted embryo. The second medication is misoprostol, which is normally taken about 24 hours after the first one. This medication induces contractions to empty the uterus.
So what are the possible side effects of the medication?
Well, you can expect cramping and bleeding. You may also experience nausea, vomiting, fever, chills, diarrhea. It can suppress your immune system. There is a high probability of seeing the fetus when expelled, and there have been reported cases of hemorrhaging, infection, sepsis, and even death.
What should someone do before taking the abortion pill?
Well, they should consult a licensed medical professional like Options Women's Care Center. This ensures that you're taking steps to ensure your health. We will conduct a medical assessment, and then from there, we'll perform an ultrasound to determine viability, location of the pregnancy, and gestational age. These are all things you need to know before having an abortion. And the abortion pill is FDA approved up to 10 weeks.
Now, Darcy, you mentioned determining viability and location of the pregnancy. Why is that so important?
It's very important because you need to determine if you have a viable pregnancy. If you do not need an abortion because the pregnancy will not continue to develop. The location of the pregnancy is very important. If you have an ectopic pregnancy, meaning that the pregnancy is implanted outside the uterus, the abortion pill will not terminate the pregnancy and can be life-threatening if it's not diagnosed.
So why is it recommended to not order the abortion pill online?
Many abortion pills found online are not FDA approved. You do not know for certain if what you're purchasing online. It is crucial for anyone considering taking the abortion pill to make an appointment with a healthcare provider before taking the medication just to protect their own health.
Well, that makes a lot of sense. I've been watching To Catch a Smuggler on Hulu, and they are always saying that you shouldn't order medication online because you don't know what you're getting, and a lot of countries don't have the same standards as the U.S. does on medication. So I have another question for you, Darce. Should you follow up with a doctor after taking the abortion pill?
That is a great question, Stace. It is very crucial for women to follow up with the abortion clinic or provider that prescribed the abortion pill to them, just to ensure that the pill completely empties the uterus. If there is any retained contents from the pregnancy and it's left in the uterus, it can cause an infection and further complications. The patient might require a surgical procedure to complete the abortion process if the abortion pill fails to do so.
That's a lot of information, but it sounds like some really good information that a woman needs in order to protect her health when going through that pregnancy decision.
So if you're considering taking the abortion pill, or you already have and you have questions, feel free to DM us. We are on Instagram at OWCC Muskegon. We want to provide you with information and support. So thank you again for tuning in to Empower Her.